All right, so get this. We're going deep on AI and medicine today. Specifically, a study that put ChatGPT head-to-head with human doctors, like a diagnostic showdown.
Yeah, it definitely shook things up.
It did. So picture this. You go to the doctor, and they're consulting an AI alongside their own expertise. That's kind of sci-fi, right?
It does, but this study suggests it might be the future.
Maybe.
Yeah.
So in this study, they gave both doctors and ChatGPT these complex medical cases.
And to everyone's surprise, the AI came out on top.
Really? By a lot.
Oh, yeah. It had a 90% accuracy rate compared to the doctors who were between 74 and 76%.
Wow, 90%. That's incredible. But how did they level the playing field? Wouldn't ChatGPT have an edge with all that medical data it has access to?
They thought of that. The cases were intentionally chosen from a pool that's been used in research for decades, but hasn't been published.
So ChatGPT couldn't have seen these cases before.
Nope, it had to analyze the information just like the doctors did.
Interesting. So it's not just matching keywords or symptoms. It's
Yeah.
actually understanding the nuances.
Exactly. It's like having a super smart medical student who's read every textbook and can put it all together in an instant.
That's amazing. So does this mean AI is going to replace doctors?
That's the big question.
Huh?
We've had AI in medicine before, but earlier attempts weren't so successful.
Like what?
Well, there was this program, Internist One, that tried to copy the decision-making of a famous diagnostician.
Interesting.
It was a huge project, but in the end, it was just too much.
So ChatGPT is the real deal because it understands language like we do.
Right. It can look at a patient's entire medical history, not just answer simple questions.
That's a game changer. So where does this leave doctors?
Well, this study suggests that AI could be a powerful tool for them, like a doctor extender.
Like a super smart assistant.
Exactly, providing insights and second opinions. But here's the interesting part. Even when doctors could use ChatGPT, they often stuck with their original diagnoses.
Even when the AI had a better suggestion.
It seems that way. It points to this tendency we have to favor information that confirms our beliefs.
So even doctors, with all their training, can be biased.
It appears so, yeah. And that's why this study is so important. It highlights the need for doctors to be open to new perspectives, even from AI.
So AI isn't the enemy here. It's a potential ally.
Absolutely.
Yeah.
It's all about recognizing that AI can help us make better decisions in medicine.
So how do we bridge this gap? How do we encourage doctors to see AI as a partner?
That's the key question. I think a big part of it is education.
Teaching them how to work with AI.
Exactly. Doctors need to understand these AI systems, what they're good at, what their limits are, and how to use them in their everyday practice.
It's almost like learning a new language, the language of AI.
That's a great way to put it. And like any new skill, it takes time, practice, and a willingness to adapt. But I think as more doctors see what AI can do, those barriers will start to come down.
So let's fast forward a bit. What does the future of AI in medicine look like?
Imagine a world where AI is helping doctors diagnose diseases earlier, catching things that might have been missed.
Fewer errors, more effective treatments.
Exactly. AI could be amazing for those rare conditions that are hard to diagnose. Think about it sifting through tons of data and spotting those subtle clues.
It's not about replacing doctors, right? It's about giving them an extra set of eyes.
Precisely. It's about augmenting their abilities, not replacing them. And that could free up doctors' time so they can focus on the human side of medicine.
More time for patients, less time on paperwork.
Right. Building relationships, providing support, and making those tough treatment decisions with patients.
So AI does the heavy lifting with data, and doctors focus on the things AI can't do.
That's a good way to think about it. This collaboration between human expertise and AI, that's what could really revolutionize healthcare.
It's exciting, but are there risks? I mean, giving AI such a big role in medicine.
Of course, with any powerful technology, there are ethical things to consider.
Like what?
Well, we need to be sure these AI systems are reliable, unbiased, and used responsibly. We need rigorous testing, transparency, and to be sure that the AI is making recommendations based on solid medical knowledge and not just picking up on statistical patterns that could lead to mistakes.
So it's about embracing the potential, but being cautious at the same time.
Exactly. Finding that balance between innovation and responsibility, using AI to its fullest, but always upholding the ethical principles of medicine.
And what about patients? Will they be comfortable with an algorithm contributing to their diagnosis?
That's a fair question. It's understandable that people might be hesitant, especially when it comes to their health.
It's a big deal.
It is. But I think as people become more familiar with AI and they see its potential benefits, those worries will
This is
ease.
down to trust, right?
Absolutely. Trusting that these systems are used correctly and that their goal is to improve our health.
And being transparent with patients.
Definitely. Patients need to know how AI is being used in their care. They need to be able to ask questions and express their concerns.
It's not AI versus doctors. It's AI and doctors working together for the patient.
Exactly. Building a system where AI enhances the doctor-patient relationship.
And you mentioned the importance of human oversight.
Mm-hmm.
Can you give us an example of how that worked, one of the cases?
Sure. There was this case with a 76-year-old patient who was in a lot of pain after a procedure to widen a coronary artery.
Ah, and that's where the doctor's diagnoses differed from ChatGPT's.
Right. A lot of doctors thought it was complications from the procedure or maybe a blood clot, which made sense given the patient's history.
Seems reasonable.
But ChatGPT looked at all the details and suggested something else, cholesterol embolism.
What's that?
It's when cholesterol breaks off from plaque in the arteries and blocks blood vessels in other parts of the body.
Oh, wow.
It can happen after procedures like the one this patient had, and the symptoms can look like other things, so it's tricky to diagnose.
So ChatGPT, by looking at the whole picture, was able to make a connection that doctors might have missed.
Right. And this shows how valuable AI can be in expanding what doctors consider, helping them think outside the box. But even in this case, the doctor made the final decision on treatment.
So AI acts like a sounding board, offering insights, but the doctor is still in charge.
Exactly. I believe this collaboration, AI and doctors working together, will lead to the best outcomes for patients.
This whole conversation has been fascinating. It makes you think about the future of the doctor-patient relationship. If AI becomes so integral to healthcare, will it change how doctors and patients interact?
It's a question a lot of people are asking.
Yeah,
Yeah, you wonder if AI will make healthcare less personal.
it does make you wonder.
But I actually think it could do the opposite.
Really? How?
Well, think about it. If AI can handle a lot of the data analysis and the initial diagnosis,
Okay, yeah.
that frees up doctors to spend more time with their patients, really listening to them, understanding their needs, coming up with personalized treatments.
So instead of being buried in data, doctors can focus on those human connections.
Exactly. Shifting things back to the heart of medicine, that doctor-patient relationship, and AI can help make that happen.
But what if AI gets so good that it's better than humans at every part of medicine?
It's possible, but I still believe that human element is essential. Patients need more than just a diagnosis and a prescription.
What do you mean?
They need empathy, they need to feel understood, they need someone to guide them through what can be a really tough time.
Yeah, a serious illness is scary.
It is. So even if AI could give a slightly more accurate diagnosis, I think most people would still want that human connection.
I think so too.
That's why I see the future of medicine as a collaboration. Doctors and AI working together, using each other's strengths to give patients the best possible care.
A partnership, not a competition.
Exactly. That's a much more hopeful way to look at it. And it raises some interesting questions for all of us as patients. How do we prepare for this? How do we make sure AI is used ethically in our own healthcare?
That's a good point. It's not just up to the doctors, is it?
Nope. We all have a role to play. As patients, we need to stay informed about AI and healthcare. Ask questions, talk to our doctors, and push for policies that put patient safety first.
So we need to be active participants in our own care, especially as AI becomes more common.
Absolutely. The future of healthcare is being shaped right now, and it's up to all of us, doctors, patients, policymakers, to make sure AI is used in a way that benefits everyone.
Well, this has been an incredible deep dive. We started with ChatGPT going up against human doctors. And we ended up talking about the future of healthcare as a whole.
It's a field that's changing so fast, and it's definitely going to keep sparking debates.
It is. But one thing's for sure, AI is here to stay, and it's going to have a huge impact on healthcare.
It will. So as we move forward, we need to keep asking those tough questions, keep the conversation going, and make sure AI is used responsibly and ethically.
For the benefit of all.
Absolutely. Remember, technology is a tool. It's up to us to use it wisely to create a future where healthcare is more accurate, more efficient, and more human-centered.
Thank you for joining us on this deep dive into AI and medical diagnosis. We'll be back soon with another exploration of cutting-edge ideas and how they're shaping our world.